there's a way that we're able to think around how you critically appraise either a study or an analysis or a clinical model. As part of your medical training, you're taught to look at sample sizes and, statistical significance. And we can bring that knowledge and expertise and look at a study that potentially an organization is looking to scale and say either, yes, that was an amazing study and that makes a ton of sense, or you can say, actually, I think that this study was flawed for this reason. And I think there's a lot of critical thinking and data analytical skills that physicians can also bring.
Welcome to Startup Physicians. Please like and follow our show to join our community of physicians who are reimagining healthcare delivery.
Hi, everyone, and welcome back to Startup Physicians. I'm your host, Dr. Allison Kerfman, and I'm so excited to be joined today by my friend and colleague, Dr. Paige Bhansali. Paige has such an interesting background and has, even early in her career, taken so many steps to work with startups and has made such an impact already. I am really excited to have you on the show today, Paige. Thanks for coming.
Thanks for having me, Allison.
So, can you share with us a little bit about your journey and how you got started in startups? And I know even all the way back to your training days, you were already exploring ways to contribute to industry. And I would love to have you just share a little bit about your journey so far.
Of course. So to me, my journey starts in childhood. I went to an elementary school. It was a city public school in Minneapolis that was initially designed for kids with disabilities. And my mom was a school nurse, not at our school, but she would sub at the school sometimes. And so I just had a lot of exposure to children with different backgrounds and different abilities, and just felt very passionate about children and pediatrics generally, which made it a very natural kind of transition into pediatrics as an adult. And I'm a practicing pediatrician just like you. So in terms of my journey into the startup world, before I went to medical school, I had the opportunity to work at the Boston Consulting Group, where I was working with healthcare clients, specifically providers who were transitioning to value-based payment models, where you really try to value the outcomes of patients and the quality of care that's being delivered versus reimbursing physicians for each service that they provide on an individual basis. And I saw a lot of interesting work being done in the adult space. And I was really intrigued by that and was interested in how can you apply these concepts to pediatrics? How can you reimburse and value pediatricians for the work that they do, for the contributions that they provide our society? And so I wasn't exactly sure how I wanted to pursue those concepts. I really enjoyed at BCG, working at a systems level, and I wanted to spend a little bit more time, on individual problems. And so when I went into medical school, started doing research in the value-based care space, and sort of felt like I kind of swung the pendulum from working at a very macro level, how you can apply these concepts to society, to a very tactical level of solving an individual problem and really trying to get the assumptions right. And then I kind of found this sweet spot in the middle where if you work at an individual company, such as a startup, you can actually take, the results of those studies and bring them to life and see how you can scale them in a financially sustainable way. And so throughout my training, I kind of worked at a few different types of organizations, trying to figure out what that sweet spot was. Do I want to work at inside the government? Did I want to work at a startup? Did I want to work for a health insurance organization? And really fell in love with the startup world. One, because of the pace with which you can create change. Startups move fast, and you can design a model and see it in action in a very short time horizon. And the other thing that I really liked about startups was the opportunity to innovate, the opportunity to do something different, and sort of that vision of, a grander world that we can create, and being a part of making that vision a reality.
Yeah, that resonates so much with me. And I know that you and I have both talked a lot about all of these things that people have innovated and created in adults, and how we can bring that to the pediatric population. And it's just so much opportunity. You're already on a very different path than most doctors, even before you even got to medical school. So I think that little foray into BCG was an incredible opportunity for you. And then I know you did some other things even during your training that actually blew my mind. I was like, I didn't know you could do anything else during training. Do you want to talk a little bit about some of those opportunities you had while you were training?
Yeah, I'm definitely the type of person who, if you're given a path, I'm kind of like, I'm going to figure out a way to do it my way. And so,
Yeah, and most people should know that I sometimes wonder if Paige is like a robot or a cyborg, because sometimes she's doing like so many things at once. I'm like, do you sleep? But she swears she does. So don't be intimidated if she tells you all the things she did during her residency, and you think, I just did residency during residency. But tell us a little bit about those
yeah,
opportunities.
well, I hope what I want the takeaway to be is that, you can create your own path, whatever, if you think that you're, have to do things a specific way, sometimes there's a little bit more flexibility than meets the eye. And so I hope that
that's a very startup-y way to talk.
maybe that's why I found myself in startups. But yeah, I kind of, what I love about medicine is that it is, you always have job security. You're going to training for whatever your specialty is. And at the end of the day, that is, both a knowledge set that you will carry with you for the rest of your life, but also, a job that you can fall back on that a lot of other people don't necessarily have the privilege of. And so what that affords you, you can try out different types of opportunities, be it part-time, be it full-time, and really kind of find what your sweet spot is in terms of how you want to create value for society. So that was sort of my approach, was during my electives, or even there was a period of time where I actually took my residency down to half time for my last year and spread it over the course of 2 years. So that way I could create space to explore different types of opportunities, specifically in the startup world. And so I kind of
you made your own path.
I made my own path. And I think that, that's what's so great about medicine, is that you can do that.
I don't think people think that way often. I think they think, I am a doctor, I have a job, I have a salary, my head is down, and I'm in this like silo of a system, and this is my option. I don't have a whole lot of options. So to hear you talking about how much freedom doctors actually have, because we can create opportunities for ourselves, because we have a very, very marketable skill, both to startups, but also clinically. Like you will never not be able to get a job anywhere as a doctor. Like that would be very, very unusual. So I think that freedom mentality is one that sometimes has to be taught to people. Most people don't automatically feel that way.
Yeah. And I hope that, through your podcast and through your course, that people can, feel that inspiration to work outside of kind of the status quo, and feel that freedom to try things out and dabble in different types of opportunities.
So what were some of those things you did during residency?
So interestingly, right before I went to residency was when the pandemic hit. All my vacation plans that I had worked so hard for were canceled. I was sitting at home thinking, I want to do something. I want to contribute to everything that's going on and find a way to try and help make it better. And so I just started reaching out to people and trying to connect with organizations. And at that specific time, there was a lot of need for just people who were all hands on deck for different types of initiatives. So I worked at a regional health plan that needed help figuring out how they were going to transition a lot of their care delivery model to be virtual. And so helped them think through what that strategy looked like.
How did you feel confident as a pediatric resident to be like, I'm going to go consult? Well, I guess you had a consulting background. That's what people don't have, but it's something that's so easily learned. It's not like as hard as medical school, right? But
Yeah.
you saw opportunities. You're like, you know what? I'm going to do something. I'm going to go help this big health plan, like figure out how to convert to virtual.
Yeah. And I think too, those skills, you can teach them yourselves, or you can find a mentor. Finding someone, who has gone down that path, I think can provide people with a tangible view into, this is how I can build these skills. And so I've been very fortunate in the sense that I've always had really amazing people teaching me along the way. And sometimes those relationships, happen naturally. In medical school, you're assigned mentors, and sometimes those can, you can create those relationships on your own. If you see someone who's doing something interesting, you can just reach out to them on LinkedIn, or find their contact information online. Or I think, the way even we got connected, I had worked on a research project with a physician mentor of mine, and we reconnected maybe like a year later working clinically, and I told him I was interested in innovative care delivery models for pediatrics and how you can reimburse for that in a financially sustainable way. And he was like, "Oh, I know this woman at this other hospital."
Because I also worked on a research project with the same research mentor.
And he was like, "Do you want to be introduced?" And I was like, "Yeah, I mean, probably nothing will come of that." And then it turns out that, that person was you, and that you were building this amazing company that is creating so much amazing impact today. And that was what spurred our relationship and all of the work that we did together. And it was completely serendipitous.
It was amazing. Paige was a very, very early advisor for Imagine Pediatrics when we were still incubating it and we were still at the private equity firm. And yes, my research, someone I had written a paper with, reached out to me and was like, "Hey, I have this resident who's like interested in value-based care, and she has like a really cool background. Like, I know you're building a company. Do you want to talk to her?" And I was blown away when I met you. I was like, okay, she's been a consultant. You worked at CMMI. You didn't talk about that. When did you work at CMMI?
I had a period during my first year where we had sort of a health equity block where we had blocked off time to work on a project, and similar kind of story, was just open to conversations with people at different organizations. I knew CMMI was working on their first pediatric model.
And that's the Center for Medicaid and Medicare Innovation.
Yep, exactly.
So government, you worked in government.
Yep. It was just sort of serendipitous. And all of those experiences sort of built on each other. Like, to your point, yes, I worked in consulting. I got a little bit of skills, but I wasn't there for a super long time. It was all of the other projects that I worked on that helped continue to build that up to where I am today. And again, that all came back to serendipitous, being open to conversations, and then also being willing to be mentored, to be taught, to learn those skills through hands-on experiences.
Now, I say serendipity a lot too, because there's like, my career has been bizarre and there's just been these things that popped up but you also create opportunities for yourself. So like there's an element that's like, yes, this very fortunate connection happened, but it's also like these connections may be all around us, and certain ones of us may be more open to them and more pursuing them. I do think there is some luck in serendipity involved, but also a ton of like creating your own pathway, which you're an amazing example of. And when we first started working I met Paige and I was like, oh my God, I need her help like right now, because we were incubating. We only had 3 people at the company, and we had different skill sets, but Paige had a very, very unique skill set. And so one of the things that she and I worked on initially was working through claims data and creating a selection algorithm for the company. And it was such fun work. And I'm curious to know your perspective about like how it felt to be working with such an early stage company, and what you liked about it, and kind of your thoughts on that time period.
Well, it was such a fun time. One, just working with you and being with someone who, again, provided such awesome mentorship. But in addition to that, what I liked about that time was feeling the value that you can bring as a physician. When you think about claims data, you can cut the data so many different ways. You can have health economists look at it, but it really requires a clinician to kind of bring that to life, and how you kind of cohort patients. So for example, we were talking about transplant patients, and do we include them in the model or do we not include them in the model? And we had bucketed, the health economists had bucketed all the transplant patients into one category. And you and I were able to sit there and say, actually, different types of transplant patients would have different pathways. And so, maybe there are certain types that do make sense to include in the model. And being able to provide that context, I think is really invaluable to early stage companies.
And I think any physician could tell you that the clinical outcome and pathway and life after transplant for a child with a corneal transplant is very different than a cardiac transplant. So those are the sorts of things that we as physicians we went through 10,000 ICD-10 codes on multiple times.
Yes.
And we're still doing that. But it was clinical knowledge, right?
Mm-hmm.
So I have had this conversation with doctors of multiple different specialties, and I've pretended like, oh, if I'm a company that, has a bunch of investment bankers and a bunch of like economists, and I were to give you a list of ICD-10 codes in your specialty, could you tell me what they mean? And they're like, well, yeah, I could tell you what a corneal transplant is. Like, guess what? They don't necessarily know those things. And so I think that's such a good example of using knowledge that we consider like common knowledge as doctors. It is not common knowledge. It is specialized knowledge. And I think what we created together, it became the core of the company. It became a very, very important part of how we deliver care to kids. And that was a really fun time working together. And I really appreciated all of your perspective. And even as a physician with a similar clinical background to you, like we came together and had very different perspectives on certain things. And sometimes it's the melding of the minds that is really needed to create something amazing.
I totally agree. And one other piece, just thinking about what physicians can add to organizations, it's the clinical context. And I also think there's a way that we're able to think kind of around how you critically appraise either a study or an analysis or a clinical model. As part of your medical training, you're taught to look at sample sizes and, statistical significance. And we can bring that knowledge and expertise and look at a study that potentially an organization is looking to scale and say either, yes, that was an amazing study and that makes a ton of sense. Or you can say, actually, I think that this study was flawed for this reason. And I think there's a lot of critical thinking and data analytical skills that physicians can also bring.
Absolutely. You and I are both like kind of research nerds. We met through our research mentor, and both of us have published a lot. And I think that is a huge skill. Even if people are like, oh, I'm academic, it's like, well, then you probably know a lot about research. And a lot of these companies are trying to prove something. They have an idea, and then they have to make the idea make sense on paper and make sense on a written financial model business plan. And they have to have some proof of concept. And sometimes the proof of concept comes from like pulling in other studies and seeing what other like for us, a lot of what we looked at was like other models in adults and which pieces of that actually could apply in kids. And but you use that as supporting evidence. So like even doing literature reviews, you did a ton of lit reviews for us and pulling concepts together the way you would for a research study. And then helping companies understand, okay, if you do get runway to do a pilot or a beta testing or some sort of phase 1 of your product or service, what are the most critical things to measure? Like we had a whole metrics framework about like what we needed to measure to be able to get the second contract. And I think that was incredibly valuable to an early company too, because we thought of a lot of clinical things that maybe wouldn't have been top of mind for people with a background in private equity.
100%. And I think too, particularly when you're working in a space that, there isn't a ton of evidence, such as pediatrics, because it's been overlooked a lot in developing these types of innovative models, being able to say, these are the proof points that you would need I think is critical in order to build up that evidence.
Yeah. And then we got a ton of traction. I'm pretty sure we tried to get you to quit residency. I can't remember, but we might have. One thing that I've learned from you is about really fostering your network and your connections. You're like one of the most connected people I've ever met. Every time I talk to you, you're like, oh, I should introduce you to so and so. And this is such a common practice in this world. It's like, it's very like mutually uplifting. Like we have these connections that are like, they're just really valuable relationships. I value your unbelievable perspective on things. I love to help you with things. I love that you help me with things. I don't think I've ever talked to you without you saying like, hey, let me introduce you to someone. And it's such a positive part of working in this world.
Yeah, I totally agree. I think I personally just love getting to know people, love learning, their stories, what they're interested in, not that dissimilar to getting to know patients and understanding what their problems are and thinking through, how you can work together to solve them. And when I think about networking and connecting people, I often try to think about, how can both of those people help each other, So if I'm going to introduce you to someone, ideally it's a situation where you would benefit from that introduction and that other person would also benefit from that introduction. And I feel that paying it forward, because I've been so privileged to have people being so willing to introduce me to people, as we already discussed how I got introduced to you. That's how interesting, things are built when people from different backgrounds or, trying to find someone who has the missing skill set that you don't have. I think it's super important. And most conversations don't go anywhere, but you learn something.
But
and
they do. You create a connection. I mean, there's people that I have a call with just because, someone like you has said like, hey, you guys should know each other. And then maybe I see them again at a conference like a year later and it's like, oh, how are things going with what you're building? And maybe there's a new need or maybe there's a new connection I can make for them. And it's funny because it's like networking, it makes you think of like going into a reception with a name tag and like it's
Right.
like it feels like when you call it networking, it's like kind of feels like a forced thing. But
Yeah.
truly it is all about knowing what you stand for and knowing what's important to you and knowing what your story is and like just having a lot of connection with people. And that's what I teach doctors initially is to figure out your story because everyone has their own set of expertise. They have their own background. Maybe you've done QI, maybe you've done a lot of research, maybe you've built a small, like I built a small program at a nonprofit healthcare system, but we all have a story. We all have something that like gets us going. I recently gave a talk to some doctors and I said, like, raise your hand if you can think of a problem in healthcare that affects your patients. Obviously, everyone raised their hand. And I said, well, keep it up if you can think of any possible solution to that problem. And I said, you're all thinking of a different problem and you all have a perspective on how to change it that frankly, the industry probably does not have someone with your perspective working on this. And so I think that, like you said, with networking and so much of it is so organic. It's about having your own story, knowing what motivates you. Like you talked about being motivated by pediatrics and finding innovative ways to bring models that have been created for adults into the peds population. Very similar for me. But we all have a story. And I think that some people haven't even started at that point. And they're maybe caught in the idea that their story is that they're an overworked doctor at a hospital or a clinic, forced to, chart at night and produce all these RVUs. And I think it starts with creating your story.
Yeah, 100%. Creating your story and hearing other people's stories. I find that hearing the different stories of different paths that people have taken to be super inspiring and helps me kind of contextualize my own story in the sense that I can draw parallels or see, oh, this person, you had similar motivations to me, and this is what you did with those things that you were inspired by. Is that something that I could do? It kind of allows you to see just what the breadth of opportunities really are and just allows you to think a little bit bigger than just kind of the one track mindset.
Yeah, absolutely. So continuing to follow your career journey, you then entered a phase where I don't even know if I can say all this. We employed you at Imagine Pediatrics. You're finishing your residency. You were in the Harvard MBA program and you had a baby, right? Did I get all that right? Like
Yeah, that was a busy time. That was a busy time for sure. Thankfully, the baby happened at the end of all of that.
and he's adorable. He's the best part of this entire podcast.
Yes, he's perfect. I love him so much. But yeah, that was when I realized that overcommitment is possible. But no,
it takes a lot for Paige to feel overcommitted. So don't feel intimidated by Paige because she's like a cyborg, but she's an inspiring robot.
No, not at all. It's hard because once you start seeking out those opportunities, and start saying yes to things, just that tends to snowball.
You open up a fire hydrant
into more opportunities, and then it comes a time where you have to learn to start saying no, which is really hard, especially when you're so excited about the things that you're working on. But yes, that was sort of the next phase of my career where
do you think people need an MBA to do this work?
I don't think so. There's a lot of different ways that you can gain skills. You can gain them through a specific program, like through an MBA, or through experience, such as, doing consulting or advising, working at a specific consulting firm like BCG. You can take a class similar to yours. You can find mentors who can teach you. I think there's a lot of different ways that you can build skills, and it's really more about what fits into your life and your schedule and your career path that you wanted to take. For me, the MBA was great because it allowed me to slow down residency a little bit. Obviously residency can feel all consuming, and I wanted a little bit more space to work on this type of work and continue my work at Imagine. And I also thought it would be a great way to build my network for the long run. And since I was training in Boston, I wanted to build up my network there, and it was a great opportunity, and I'm hopeful that it'll continue to be fruitful. But I think there's a lot of different ways that you can build skills and build a network. For me, it was the right time and right opportunity, but it's not something that people have to do.
Yeah. And I really try and encourage physicians, first off with this podcast and hearing other people's stories. And I definitely am interviewing other physicians who are not as like full speed ahead in startups the way you are. There's others who maybe are mainly clinical practice and then have done some advisory work and have learned a lot about what to say yes to and what to say no to, because you don't want to put your name behind just any company. Like we have to have a way to vet it. But there's so many opportunities. I mean, some people may have like a limited belief that like, oh, there's already someone doing that. Like, what do I have to offer? I want people to understand there's other pathways where you can be almost fully like an academic or clinical physician and still be involved in a creative way a little bit. What do you think about that?
Yeah, I think there's a lot of different ways that you can get involved. And I think that kind of goes back to our earlier conversation around the flexibility that being a physician affords, similar to how people approach a research career while being a physician. Do you want to be 80% research and 20% clinical? What percent clinical do you want to be? Like that, to me, that's kind of how I first think about that question is what's the split for you? And for some people, that's, all in on startups and, more of the administrative and management side of healthcare. But for other people, it's more of just dabbling, that they like, maybe doing 80% clinical and just something that they do on the side. And so your role will look different depending on what breakdown you want to do, because we all only have so much time in the day. And so, you can be, if you're doing a more part-time role, it might look like advising or doing consulting or doing a fractional role. And that can be perfect if that's what you want to do, especially if you want to continue to heavy clinical practice. And that can also change over time, which is, again, what I love about the flexibility of being a physician. If it's a time in your life where practicing clinical medicine really fits well with your schedule, then you can do that. But if an opportunity comes up that you're really excited about, you can dial down that if you want. And so I think it really just depends on what a person wants to do, and you're in the driver's seat. You can decide exactly how you want to spend your time, and at the end of the day, you are a physician and have this skill set, and it's a huge privilege.
Absolutely. So tell me a little bit about what you're working on now.
Yeah, so I work at an organization called Playground Pediatrics, and we partner with independent practices that are interested in transitioning to value-based care models. And so we bring them technology and services to help them improve their quality scores, as well as attempt to reduce the total cost of care for kids, in the sense that, if we can provide better coordination, better access, that we can keep kids healthier and out of the hospital. And so it's really about creating an experience that is better for providers, better for patients, better for payers, and really kind of trying to align the incentives in the same way that, a lot of startups have been successful in the adult world, but thinking through how we can bring that to the pediatric world.
That's amazing. And it sounds like you jumped right in at the very, very beginning, just like at Imagine. So I'm sure you've been looking at claims data.
Yes, yes, we have, which is super fun. And again, a great place that physicians can plug into, and then thinking through, how we can build out our clinical model. What types of programs or services can we provide that can really address all of children's medical, behavioral, and social needs, so that way they can be healthier, better taken care of, and hopefully live a much longer, higher quality of life by investing in preventive primary care from the day that you're born.
I feel like the day that the world recognizes the value of investing in young humans while they are still healthy is going to be excellent. Like, we're dealing with so many sick adults that it's hard for the industry to shift and be like, well, let's really focus on prevention. And obviously the struggle is also that the people that pay for healthcare, they won't be accountable for that patient when they're 65. They're accountable for them right now, and they're doing just fine most of the time. But I think the work that you're doing, the work that I do, the work that other folks in pediatrics do, it's inspiring, and it makes a ton of sense. And we have so many examples. And even if you're not in peds, I will probably skew towards pediatrics on this podcast because I actually know a lot of pediatricians. But even if you're in another field, there's also this translatable ability to say okay, well, somebody created this great model in cardiology. Could I actually use some of those concepts to solve a problem in, women's health or something like that? So I think seeing those parallels is a great way to start pursuing new ideas too.
Totally. It doesn't have to be something that is completely from scratch. It's maybe, for me, seeing inspiration by all of the awesome, innovative work that's been done in the adult world, and thinking through a little bit, maybe it's a little bit aspirational, but to your point, if we can invest in children and keep our citizens healthier from the start, that's going to have the largest ROI. That's not exactly the way our healthcare system is structured, but that's the vision and the inspiration. And how can we then take that and do something tactically in the direction of that? That's really what inspires me every day. And that's why I do the work that I do.
Well, that's amazing. I have loved hearing. I'm always inspired talking to you, and I really appreciate you coming on and chatting with us. I think your perspective is so valuable. How can people find you if they want to connect with you?
Oh, great question. I think I shared my LinkedIn, so people can LinkedIn me. I will respond to messages there.
Awesome. That's great. We'll put that in the show notes. So thank you everyone for joining today. I hope you were all as inspired as I was talking to Paige, and I will look forward to talking to you all soon.
Thank you for listening to Startup Physicians. Don't forget to follow, and share.